In 2008, I had one of my biggest health crises ever. I won't go into that now. We've talked about that in the past. But in 2009, in doing research on nutrition, I discovered that vitamin D plays a vital role in our health and wellness. In fact, until 2008, it wasn't known exactly what it did. They thought it was just a metabolite for calcium and helps the body absorb and metabolize calcium, which is true. But in 2008, they discovered that it controls and coordinates your entire immune system. And if you are deficient, you are more likely to get colds and flu and COVID-19 and cancer. So we've been singing the praises and recommending at least 5,000 IU of vitamin D a day since 2009. And we're seeing a lot of other natural healthcare practitioners in agreement with that. And so I was just reviewing some of the recent literature from 2020. And here's one that says vitamin D and inflammation, potential implications up for severity of COVID-19. That's from the Irish Medical Journal. And they're saying that if you are deficient in vitamin D, that you are more likely to get COVID-19 and any other types of disease. And if you are sufficient in it, you're less likely to get it and more likely to survive it if you do get it. Now they're saying that 12 nanograms per milliliter is deficient, and boy is it. And in 2008, remember when I said I was sick, I was at 17. Low is 20. Now those are crazy low numbers. We want you to be at least at 50. And that's 50 nanograms per milliliter. I suggest 60 to 80. And the only way to know if you're sufficient is to actually have a blood test. And so next time you're at your physician's office or your naturopath's, ask for a vitamin D blood test. I believe it's a dihydroxycholecalciferol 25, something of that nature. Here's another one. Evidence that vitamin D supplementation could reduce the risk of influenza and COVID-19 infections and deaths. This is from the journal Nutrients, April of 2020, so fairly close to where we're at now. Again, the same suppositions. Those people who are deficient in vitamin D are going to be more likely to contract COVID-19 and potentially die from it. If you increase your blood serum levels of vitamin D to that sufficient level I talked about, 60 to 80, then you're going to be much safer, much lower risk. And that's what we're finding out. The virus is becoming probably less virulent, and we want to make sure that we have the ability to fight it off. Now, why are viruses worse in the winter than they are in the summer? Well, typically we get more sunlight in the summer. And as we get more sunlight, we get more natural vitamin D. But for most of us, we have to supplement because we don't run around naked in sunshine 7 days a week, 24 hours a day. In fact, we're quite deficient. So we want you to get that 5,000 IUs of vitamin D3 every day. And we want D3, not D2. D2 synthetic. We want the real thing. Furthermore, they're changing away from international units. So 125 micrograms is the same thing as 5,000 IU. And then we'll just conclude with, we talk about sunlight for getting vitamin D. Well, here's one: light as a potential treatment for pandemic coronavirus infections, a perspective from the Journal of Photochemistry and Photobiology. And they basically say the outbreak of COVID-19 could be affected from a positive standpoint with light therapy. That might be in our office, laser therapy. It might mean get out and get that darn sunlight every day so that you're elevating your vitamin D levels naturally. So we want to supplement, we want to get sunlight, and we might use laser therapy, low-level laser, also to affect what's going on. So we're all about promoting health. How can we make our system healthier to bulletproof us from this virus, this pandemic, and the next one that's going to be coming? It's about getting healthier, not trying to avoid some disease or disorder by hiding out, staying home, wearing masks everywhere you go. That's trying to avoid something is not the same as trying to support a healthy immune system. And if your immune system truly is healthy, then my goodness, friends, you have nothing to worry about. So this has been the Wellness Doctor, Dr. Jeffrey Clark from Marketplace Chiropractic Wellness Center. We wish you a wonderful, wonderful day and a safe, healthy, happy life.